Well, hi everybody. I'm honored to be part of AMI, and we have a very complicated subject related to the complication that happens from non-professional injections or from material which are of low quality, sometimes of bad storage, or there's a rejection or hypersensitivity reaction. So today we're gonna have to talk about three cases that I face in my clinic. They've been injected with from non-medical personnel or injected with unknown material with complication. Um, I want to emphasize that many of the patients, they came to my clinic asking for help after they had complications after injection. I asked the patient to go back to their doctors or to who inject them and write me a report explaining the amount been injected and the brand of the injection, whatever, if it was toxin or filler, and if it was anything else like mesotherapy or plasma or whatever. This is very important in order to clarify and conclude what happened with the patient, in order if there is a long-term consequence, as we can see, because the problem is not to remove or dissolve the filler itself. The problem is with the long-term consequence that would happen, especially if there is a volume loss. Let's see the cases. Well, the first case is a 24-year-old female, medical free, presented to my clinic, and it was injected by a dentist under her eye with unknown filler, and filler is injected on two occasions. It was 2 ml, 1 ml on each side. The injection was done by a needle according to the patient history, not with a cannula, and the patient suffered from immediate burning sensation after the injection within 6 hours, followed on the second day with a bruise. This bruise was complicated with redness and excoriation, and as you can see, it is crusted and infected. The problem with this case that the patient has infection with hypersensitivity reaction. It was immediate. We treat the patient for a long time, maybe for 2-3 weeks, and the patient came back again with the same symptom. So the first case that the patient has immediate hypersensitivity reaction together with a bacterial infection, and it was treated completely, and after a while she came with the excoriation and extension of the filler. As we can see, the area of hypersensitivity was extended not only on the tear trough but on the upper cheek. It means that there is a diffusion of the material. Upon examination of the patient has all the sign of inflammation together with severe tenderness. On deep examination and radiology, it reveals that there is multiple masses of hyaluronic acid or other materials in the subcutaneous tissue. So the injection was deep. After a while, we treat the patient. The patient is improved after dissolving of the material together with injection of platelet-rich plasma in the area to rejuvenate the area. Now, case 2. This case of foreign body reaction together with vascular occlusion. The patient was injected with they said to be it is a plasma, but what proved it's not a plasma, that the patient didn't have venesection, or they didn't withdraw blood from the patient, and she had a lot of pain in that area with severe swelling. On radiology examination with MRI revealed that there is separation of the facial muscle from the bone. It means that the injection was in the periosteal level. After a while, the area of inflammation extended to include the pear trough and the periocular area. The patient was referred to plastic surgeon, and we removed the area of infection and the area of granuloma. They left a lot of depression, and as you see, volume loss. Now we will talk about our 49-year-old female, medically free, presented with in the emergency unit. I've been called to see her, and she was injected with a material that's said to be it is a rejuvenator or mesotherapy. the patient had stony tenderness and inflammation. Upon examination, it was very hard. It means that there is a lot of inflammation. Once the plastic surgeon opened the area, it was drained with severe pus mixed with inflammatory infiltrate together with unknown material. After removing of the whole material, the patient had a severe volume loss due to severe necrosis of the muscles and the subcutaneous fat. Well, overall, the complication is a lot. If you are following the good instructions, if you are following the good anatomy, and if you are using the right material, you will have complication even so, but the complication will not that severe, or it can be managed, or you cannot be blamed for injection something that it's not licensed or you are not licensed to do it. Thank you for your listening, and hope it was informative information for you and for AMI. Thank you.